Before entering the OR suite, make sure you have a mask and shield on. Introduce yourself to the staff in the room. Write your name on the status check board. Grab a gown and a glove from the cabinet in the room. Find a flat surface away from the instrument tables to create your sterile field for your gown. Make sure to check the integrity of the package and the expiration date. The first flap that you open must be open away from you. Remember to create a 1-inch perimeter that you're able to touch. If you go past this perimeter, it'll be considered contaminated and you'll have to start all over again. Then you're going to pop the correct glove size onto the gown. Make sure it does not pass that perimeter. When starting your scrubbing procedure, choose the scrub solution you want. Open the package and place aside. Now you will complete a basic hand wash to remove any gross debris. Grab your nail pick and under running water, clean the edge of all of your nails. Take your scrub brush, lather it up, and then you're going to begin your scrubbing procedure. Take the brush side and clean all of your nails for 30 seconds. Then you're going to imagine that there are 4 planes on each of your fingers. Scrub each plane 10 times. You will use the sponge side for this. Make sure not to forget the wedges of your fingers. Now you'll start in a circular motion doing the palms, the back of your hand, and you will work your way down your arm all the way to 2 inches above your elbow. Once you complete this whole arm, you'll repeat the same procedure for your other hand. Once again, 30 seconds with the brush on your fingernails, 4 planes for each finger, 10 times in each plane. When completing the scrubbing procedure, if you accidentally bump into the faucet or any surface, scrub that area again for a minimum of 10 strokes. circular motion down the arm to 2 inches above the elbow. Once you rinse, remember not to go back and forth through it. It's one movement and that's all. Remember to keep your fingers towards the ceiling. You want to allow the water to drip down your elbows. If you bump the surface while you rinse, you'll have to start the scrub procedure again. Remember to keep those hands up and back into the OR suite. Carefully pinch your towel, open it, and designate 1/2 for each of your arms. Try not to drip on your gown. Remember to bend over some so the towel will not be contaminated by touching your scrubs. Once you dry your hands and work your way down to your elbows, make sure not to come back up towards your fingers. Then you're going to grab your gown and make sure you have it correctly so both flaps your hands can be placed into, making sure that that perimeter there is towards you. Make sure you're clear of any equipment that's around and slide your hands into it. Be very careful not to put your hands too high in the air or too low to the ground. Your circulator or an unsterile team member will come and secure the back. It's very important not to put your fingers through the cuffs of the gowns, but you will use them as pinchers in order to put on your gloves. Be careful not to contaminate the front of your gown when you're bending over to put your gloves on. So first you'll grab your left glove, and with the fingers towards you, you'll pinch on both sides through the gown and flip it over your hand. It's okay if all of your fingers don't go in the slots, as long as you can maneuver your next glove over your other hand. Once both of the cuffs are completely covered, you can adjust your hands as much as needed. Now you're ready to complete your turn. So your right hand will hold the card and your left hand will hold the string. Pass the card, spin to your left, retrieve the other string and tie them together. Then make sure to put your hands in front of you. In the case that the scrub tech can actually gown you or assist you, make sure to aseptically pass your sterile package and gloves. You would then complete your scrub. Remember to keep your fingers towards the ceiling. She'll pass you a towel. Remember to slightly bend over and dry your hands. She'll assist you with your gown. Once again, remember not to lift your hands too high or too low. And in this case, when being assisted, you will pull your right hand out of the cuff. And with your glove hand, you'll actually help her glove your left. Left hand on the string, right hand on the card, turn to the left and secure. Remember to put your hands back into your sterile area.